Welcome to another episode of What Brings You In Today.
I'm Erica Bennett.
And I'm Taylor Fisher.
And we just want to thank everybody for tuning in to our podcast and for following us on your listening platforms and for leaving reviews.
And please be sure to submit your questions or topics you would like to hear us cover at sgmc.org/podcast.
All right. Today we are here with Dr. Joseph Hayes, internal medicine. And Dr. Hayes has been a guest on our show before, so you are officially our first person to come back for a second episode.
Thank you for having me. I'm super excited.
And it was our award-winning episode.
That's right. That's right.
Oh, man, let's lower the bar just a little bit here, please.
But so today we thought we were going to keep it real fun. So we found this list of questions.
We didn't find it. Taylor wrote it.
Okay, it found us. The list found us.
Well, I remember before asking for ridiculous questions.
And I've got some for you.
And I thought about it, and, you know, these questions shouldn't be ridiculed. So I had to be, I want to be really careful about how I word that.
That's right. Yeah. It's the most Googled questions, correct, of the
Some of
year.
them, yes, were some of the most Googled questions for the year in the U.S., and then some we just threw in there for fun.
Okay. And we won't tell you which ones those are. We're going to keep that a mystery.
Yeah.
But Dr. Hayes, just for those that have not listened to the previous episode, go ahead and just give us a real quick background of your information about, your specialty.
Sure. I'm an internal medicine physician, and I'm from the area, trained in the area, been in Georgia the whole time, Mercer University School of Medicine in Macon and Savannah, residency in Savannah, started in Valdosta, came back to Valdosta, and now I have the privilege of teaching other doctors how to do their doctoring, and it's really a privilege, and we've come a long way here, and our internal medicine residents and our medical students from Mercer are learning a ton, and we're learning a ton teaching them, and I'm excited to help our listeners learn a ton.
Yeah, very cool. All right, well, let's get to it.
Let's go. Who wants to go first?
All right, I'm going to let you go first,
Okay.
Miss Barbie.
Be gentle.
In the pink jacket.
I don't think we're going to go in order. I'm just going to pick which ones I want to hear answered, because there's a lot of them on here. Why do people get motion sickness?
Oh, well, that's a very technical one, actually. I think to make it as simple
as... No, it's not the funnest one.
But I want to know that one,
well,
because I get motion sick.
A lot of people suffer from it. I've got patients that are going on cruises, and it can be really troublesome, and it can zap the fun out of what you're experiencing.
I can't ride roller coasters.
That's terrible.
So my sons, the last couple of times that have ridden with me, they have both told me separately, this is 2 different occasions, they're like, I've been having to take a lot of detours because there's a lot of traffic. Mm-hmm. And they both have told me around the same location, Mom, I don't feel good. My stomach's hurting. I kind of feel...
I can't ride with Erica
sure
either.
They're getting motion sickness from my wild driving.
Wow. I'll say this. I'll say this to ease you a little bit. Motion sickness is more common in kids, and a lot of people kind of grow out of it a little bit. But the gist of it is, I'm seeing some head shaking. Not everybody grows out of it, but our brains are interpreting signals from all over the place. Our eyes, right, help the brain know kind of where we're looking and what we're doing. Nerves in our hands and feet are sending senses back to the brain, and then the vestibular system in the ear is sending signals back. And if they're conflicting with each other, that can confuse you. So imagine for a moment that you're in a car. I don't know if your kids have tablets.
And they're
in the car.
on
Do they
their
have
electronic
tablets?
devices.
Okay,
so I don't think they would have got it if they weren't. So let's continue.
That's right.
Let's go.
So imagine you're in a car or in a cruise ship, and you're looking at a flat screen or a screen in front of you, and nothing is moving. Right, you're in the car, you're moving, the heads are bobbing, right, but they're looking at the screen, and things are staying still, but their ears are sensing the movements. The fluid and the hair in the ears are sensing things are moving. It's really, really bad in cruise ships because you're in an entire room that doesn't move, but yet your ears are feeling the movement, and it can confuse you. And there are some ways to mitigate it. If your kids aren't on a tablet, which I think if you're on a long car trip, I'm not a proponent of tablets by any means. I think Dr. Blosh would get at me for saying this, but sometimes I'm like, just look at the tablet.
Yeah.
But in a cruise ship, for example, you've got nothing around your periphery. But if you go out, maybe if you're watching the ship go up and down, or if you're in the car and you're seeing the things move, it should be a little bit better. But there is medicine, safe medicine, even for kids, that can kind of calm or tone the nerve senses down a little bit in the ears, like
I had to sneeze, sorry.
Okay. Like your Dramamine or your scopolamine patches and such. Yeah. And so you can use those to kind of mitigate it some.
Well, okay, and I probably need to drive a little better, but you know,
Ask a more fun question.
I will, but let's get back to our ears sensing real quick because that's weird. So our ears can sense, like I think about like a snake or things that don't have eyeballs, using the animals that use their ears to sense. Okay, whatever. Maybe they have eyeballs. They don't have ears.
No, they do.
Do they have ears? Okay. Anyways, I digress. I'm not a biologist or.
That's okay. That's okay.
All right, but what are ears sensing?
Yeah. Yes.
I mean, you think about touching things, sensing. Ears. That's weird,
so
right?
your ears have canals that run in different directions, and there's fluid in there, and little tiny hairs. And if you move your ears or move your head real quick, the fluid will kind of shift and tickle those hairs, and that helps send the signal back to the brain. Some people even get little stones forming in the ears, and it can make people really dizzy.
You get vertigo.
Wow.
You can get, that is correct.
Okay.
And sometimes we do movements in our clinic to reposition and get the stones stuck so that they don't get dizzy and woozy or nauseous.
I get vertigo too.
Yep, that can happen.
Okay, all right, I've got a fun one. Okay. I've got a fun one. Okay, what causes hiccups? And is there actually a way to stop them instantly?
Okay, this is another fun one. Well, you've got nerves that send signals back from the stomach and from the diaphragm, and we think that irritation or overstimulation of those nerves can cause that involuntary contraction. You know, the one that gets the diaphragm. The diaphragm, by the way, is what pulls your lungs down like an accordion to breathe. And you share a lot of similar nerves with the shoulder and with the stomach. And if you do things like over distend the stomach, for example, really quickly, like with say a carbonated drink, drink a soda really fast, and then it kind of swells and distends the stomach, or eat really really fast, those sorts of things can irritate the phrenic nerve and other nerves that are the vagus nerve that are carrying signals to and from that diaphragm, and then the diaphragm will try to contract, and then the vocal cords will kind of squeeze down, and that's where you get that hic, that hic sound. And it can be really annoying, and sometimes I think like the more you pay attention to it, the worse it gets. At least that's my anecdotal feeling.
And obviously, you get up, you take a sip of water, you get upside down and hold your nose and your ears at the same time and swallow it, and that gets rid of it, right? Is that what you do? Does it work for you? I don't think it works.
What
I don't
do
think
you
it
do?
works.
I just wait till they stop.
But I have heard that before. I think I've tried it, but I don't think it works.
Sometimes they don't stop. There's when I looked at this, there was a case report of somebody that suffered from this for years.
I saw them on the news. I saw them on like on the Today Show.
Well, that's never happened to me.
This little girl had hiccup for like a very long time, and it was mystifying.
Could you
the whole
imagine
medical
having
community.
that all day, every day? That's
No. That would be horrible.
Well, you know, they're short of medicines that can, if this happens frequently, or let me just say this to the listeners: if you're having hiccups all the time, talk to your doctor about it. But I think there's a lot of old wives' tales that may help with this. I think what probably helps the most is trying to reset that whole distension thing, and I think that what may help with that the most would be holding your breath for a long period of time, or really, I think even more effective than that is to breathe out for as long as you can and hold it out for as long as possible. And I think you'll find that that'll be very helpful for you.
Right.
Okay.
I'll give it a try next time.
That was a lot more fun than
report
my
back.
question. My next question: why do people faint at the sight of blood?
Oh, almost like a fainting goat, huh?
Or get sick. So I get sick to my stomach. I think Kara Hope has fainted. I've never fainted, but I do get sick when I see blood.
Have you fainted?
I did get lightheaded one time, and then I got better. I just decided I was not going to allow it to let me faint, and I mentally got over it. Like I told myself, I'm not going to let this bother me anymore. And I would think about different things while I was getting my blood. And so I give blood now, but I have fainted before from giving blood. But now I mentally am
we're not all as strong
doing
as
it.
you, Erica. Some of us are weak.
But so tell us I want to know what the.
Well, let me say this. I don't think it's a weakness.
Well, and because if you're gonna have a kid, when you get pregnant too, and you're gonna have a baby, you really got to get over the medical stuff a little bit because it's coming.
In medical school, one of the medical students fainted during a procedure. She went off and sat up against the wall and just kind of slid down in slow motion.
Does that discontinue them from medical school?
Well, they decided they didn't want to be a surgeon, I think, at that moment. So, but it can happen.
Yeah.
Well, I think what you're experiencing is a couple things. The root of it, and what I want to get back, what I want to focus on is the blood pressure in the heart where you're feeling on the right side of the heart is quite low. If you think about your blood pressure when you have it on your arm, you might get a number of 120 over 80, and like millimeters of mercury. The blood pressure where you're filling into that right atrium, that area there is 3, 4, 2 millimeters of mercury. So very, very low. So now imagine if you do something that raises the pressure in your chest, which is normally very, very low. In fact, it's usually negative. And so, you take a breath, negative pressure pulls air in. But now imagine that you're squeezing down, or you're bearing down, or you're nervous, or you're anxious, or you're holding your breath. That pressure in the chest can exceed the pressure in the heart. And when you've got no blood pressure, you can't feed the brain, and there you go. And then you relax when you're passed out, and then everything comes back to normal. But so what we see for a lot of folks is it starts kind of like with this fight or flight hormone. The sympathetic nervous system starts getting amped up because you're getting nervous, and then you kind of tighten up. And that's kind of where it happens. And so calm breathing
relax.
And trying to relax, which you ever tell somebody that's not relaxed, just relax.
Yeah.
It doesn't go over well. But I think what you've learned is you've learned some
to control
some techniques.
some coping mechanisms.
That is correct. And then that has gotten you through it.
Right.
Yeah.
So deep breathing.
Yeah.
Don't look at it.
Therapy.
Don't think about it too much.
I go to therapy.
Either one, you can get it done. You just talk to your therapist about that. You don't need to get anxious
We have a
about
lot
seeing
of other
blood.
things to talk about.
I think
before
everybody
that.
should have a therapist. Just by the way, everybody, even athletes perform at their best when they have therapists.
Yeah.
So,
Let it out. We gotta talk about stuff. We can't keep it all in. Nobody's.
Well, we're
That's
letting it
never
out
good.
now.
Yes, exactly. Is it my turn?
Yeah.
Okay.
Let it out.
All right, I'm gonna let it out. Let's see. Okay. Why do we cry when we chop onions?
You feel bad for the onions, obviously.
I mean, or you just hate making dinner and you're like,
Well, have you learned some?
roast
Do you have
really-
any tricks to not cry when you do it?
I have one. If you don't have
I don't have one, I don't think. Which I don't cook often. I need to get better at that. So.
Last night, my husband was chopping onions, and he went to the garage and got a pair of safety goggles. I'm sorry, babe. And he put them on his eyes, and I have a picture, which he told me I couldn't show anyone. And he
So
said,
we'll be sure to put
Can
it
you post
on
that?
the
Could you
YouTube
post that?
video
Just
when she talks
flash
about
it.
this. Let's make sure.
he said that it did not bother his eyes with the safety goggles on. So
So he didn't feel sad for cooking for you. is what it
no,
sounds
he
like.
just looked ridiculous.
Yeah, I'm sure that was a good laugh.
Well, I would imagine the onions don't want you to eat them.
Yeah, that's right. What
Okay,
it is.
and that's what this
Obviously.
is. It's a volatile compound that
It's
gets
because we're
released in
peeling back all
injury.
their layers,
You-
and they're tough.
That was good.
They don't like to,
Well,
We are their therapist.
yeah, I think they need more than therapy after they've been
Okay.
chopped up. To be
Okay,
eaten.
okay.
So they don't like getting chopped up, and that injury releases a volatile compound there that irritates the eyes, and your eyes say, "Oh, I don't like this," and so you start tearing up to flush it out. So goggles was actually a very great idea from your husband if he doesn't want to be bothered. But you can do some other things too. You can if you soak the onions or wash them, that can help. I don't want to use the word break up, but it can help mitigate the release of the volatile compound. It's got a long name. I didn't even bother trying to memorize it, but you can look it up if you wanted to see what it is. Or cutting them under running water can be helpful, for example.
Well, and they smell. Like, the smell on your hands, like, lingers. Yes. It's, like, nearly impossible to get. Well,
it's getting released.
Yeah.
The compound is. And also, interestingly, a really, really sharp knife is going to make you cry less.
Yeah, because it's injuring the onion less.
That is right. It's just a nice,
they don't feel as much pain. Cut. How do we know that onions don't like being chopped up? I mean, like, how does a...
We don't know. We don't know. But we don't know a lot of things.
I think we've gotten off track.
I don't know, but
we used to not know. We used to not think babies felt pain.
Okay, we're not.
Wow.
No, this is true, and this isn't exactly remote history. But that's not one of your questions. The listeners can look that up. So.
But that's crazy.
It's terrifying, actually.
Okay. Let's do something less weird than that. Why do we shiver when we have a fever?
Okay. You want to guess?
Because your body is hot and we're trying to cool it down. So it's just like the onion that doesn't like to be chopped up. We don't like to be hot. Our body doesn't like to be hot. So it's releasing fluid to cool us off, and then it makes us cold because that fluid hits the air.
I mean, I follow your logic.
Okay.
I do.
What you got?
Actually, I would say it's a little different. The body wants to be hotter.
Oh.
So when you're sick, part of the response to that illness is to say, well, whatever habitat that virus or bacteria is living in, let's make it worse. And so raising the body temperature is one of the defense mechanisms of our immune system. There are certain chemicals that are released as part of the infection or the response to the infection, and then in the brain, the hypothalamus sets the temperature. So you have a thermostat, and it just turns the thermostat up. The heat and the fever that you get is actually helpful. In fact, I'm not much of a proponent of Tylenol or acetaminophen because there is some evidence that bringing a temperature down can prolong the illness. Right. But you do feel better with it. And I also want to say, too, for the listeners, that you can get too hot. I mean, for me personally, based on the evidence in my practice, I don't get excited about a fever until we see 103. I really don't get worried about it until I see 104. Damage is above 105.8 degrees Fahrenheit. Okay. So, when I'm in the hospital or when I'm treating my patients, if somebody has a temperature of 101 or 102 or even approaching 103, my response is if you feel bad and you want to feel better, you can take some acetaminophen. Right. But bringing that fever down is not helping you fight the infection.
It's just helping you be more comfortable.
Helping you be more comfortable. And to be honest with you, I think if I had the flu, I'd probably rather be more comfortable.
Yeah.
For a little bit longer and have the flu for 12 hours longer. So,
yeah. Okay, I got a good one.
Okay.
They say laughter is the best medicine. Can laughter really improve your health?
Yes.
Obviously.
Yes.
I knew that. I knew the answer to that.
You're going to find a lot of the questions that you have, or a lot of it's going to come back to stress. And so just to kind of lay the groundwork for anything that may come up later, more stress is more cortisol. That's one of the stress hormones that's released, and it's really not very good for us. Weight gain and insulin resistance and hair falling out and things like that. Truthfully, laughing can really, really bring down your stress levels, and it can help to heal you. The mind-body connection is a real thing, and oftentimes, feeling better mentally will help you feel better and be better physically.
I've been seeing a lot of ads on my feed about cortisol detox. What is that all about?
Well, this is where you just tell people to relax.
Okay.
Just relax. Just relax.
But can you do a cortisol detox? I mean, how does that?
Without cortisol, you would be dead.
Okay.
You have to have cortisol. Your cortisol levels increase in the morning.
Right.
As you wake up, and that's part of the waking up response that you have, and then they tend to kind of go down during the day.
That's a stress level because you're like, I'm awake.
Well, it's associated with stress. How about that?
Yeah. Okay.
And you need cortisol. In fact, some people that have problems in the brain, we have to give them a replacement of cortisol, or else they would feel terrible. They would have headaches, and blood pressure would be low, and so you do need cortisol.
Yeah.
I think.
But maybe like excessive cortisol. Like maybe you're feeling bad because you've got too much cortisol.
Well, if you're depressed or have certain medical problems, you can certainly have more cortisol. There's conditions where people make too much cortisol in general, and they tend to gain weight and have diabetes and be unhealthy and get heart disease. And so I think there's no drink
anything,
or anything like that.
supplement, anything you can buy to kind of.
Yeah, I think therapy. I
Okay,
keep coming back
some
to that.
natural things.
And being active and exercise and socializing, and sometimes that's hard to do if you're not feeling good. But I think the best way to detox is to try to be involved and be active. And like I said, that's unfortunately that's like telling somebody that's nervous, don't be nervous.
Right, yeah. Well, and then I've also I've had a doctor tell me before that a lot of heart attacks happen first thing in the morning because the cortisol levels are higher.
That is correct. That is accurate.
Can
Yeah, that is. And higher cortisol levels lead to more salt retention, higher blood pressure, but yeah, absolutely. One of the most common times to have a heart attack is waking up in the morning.
Yeah.
Okay, mine is less serious than that. Is the 5-second rule for drop food actually safe?
I like to say it is, only because anyway, I shouldn't be admitting that. We can scrub that, right?
You already went there. You already went there. You can't take it back.
But the this is something that I looked up, not to know the answer, but to get some nuances here.
Yeah.
First of all, the 5-second rule is not real. Like if you drop your food on this table, that and this is a very clean table, but I'm sure there's some bacteria or fungus or something on it. I mean, it's everywhere all around us. If you drop a piece of steak, it's going to be on the steak. It doesn't matter whether it's there for 1 second or 5 seconds. But there is a little truth to the longer it's there, maybe the more that you get on it. So that's kind of true. I look back at the origins of maybe where this 5-second rule came from, and I saw that it started allegedly back with like Genghis Khan and the Mongols, and if he dropped his food on the floor, everybody could still eat it because his food was I guess super well prepared supposedly. And then Julia Child, I think she was a French cook.
She was British.
British,
but she cooked French cuisine.
So you know about her. Well, apparently she had dropped a pancake she was making or tried to flip it and made a comment. And I don't think she used the 5-second rule, or she said, but I think that's kind of where it came from. So the truth is if you drop food on the ground, whether it's for 1 second or 5 seconds, it's got bacteria on it. And what you do with it after that is probably should be private.
I think it also depends where you drop it. Like if I dropped it in the hospital, I wouldn't eat it. But maybe if I dropped it at home and I just cleaned the floor, then I might eat it. And my dogs hadn't been on the floor.
We have very clean floors.
I don't know. There's a lot of people that walk in the hospital. There's only 2 people at my house.
Well, I've picked up things before, and you justify it with I'm building my immune system, or you make a joke.
Yeah, boys will be boys. That's some little kids that eat dirt, back when they were little.
Okay, best way I can say this is
sand. I mean, sand at the beach.
I don't
feed them dirt.
I think what I'd say to this is approach dropping the food and picking it back up, up and eating it as kind of like driving without a seatbelt. You can usually get away with it until you can't.
Right, you're just taking your odds.
You're taking your odds.
Yeah.
Yeah, that's my answer. And whether it's 1 second or 5 seconds, I think you could make the argument 5 seconds is worse or 10 seconds is worse. But depends on a lot of
It's
things.
all until you get that stomach bug.
That's right.
Then you'll never do it again. All right. This one I definitely remember hearing as a child. And so I'm interested in this one, but is swallowing gum bad for you? So I remember hearing that it takes 7 years, I don't know why 7 specifically, to digest. And I would just picture that gum sitting in my stomach for 7 years. Until, whatever.
How many times did you swallow gum?
I mean, several times.
I mean, like at some point, your stomach would be all gum.
I know. So tell me, how long does it take? Is it bad for me?
Well, I actually...
Probably if you swallow a lot of gum, like every day, it's bad for you.
Well, I don't know how long gum actually takes to digest, but it doesn't digest in the stomach. You just kind of pass it through.
It just kind of breaks up maybe and then...
Not really.
No, it just...
kind of just...
What is in gum then that we shouldn't be eating it?
Types of non-digestible sugars and other things. Well, so what I'd say to that is it's almost certainly going to be harmless. Although there are case reports, and there are times where particularly kids or young children, the gum can get stuck in the digestion and block things. And so I certainly wouldn't...
that's why you tell kids that.
Yeah, you definitely don't want your young kids chewing and swallowing gum. I would definitely avoid that. But odds are, you're probably not going to develop any kind of problems. And no, you don't digest the gum. It just
You
kind of
just
passes
scare
through.
them so they don't do it. Just
Like with most things in life.
Like what all of the things that you were taught as a child. You find out later on in life that was just your mother trying to protect you, or
Yeah, but there's a little truth to not swallowing the gum, though.
I've never swallowed gum.
Really?
Never.
I still will. If it's a choice between spitting it out somewhere or swallowing it.
Yeah, because I feel guilty.
I'm gonna
gonna
have to swallow
Because
it.
somebody
Why?
else might step in it. If I don't have a trash can to put it in, I always feel good that somebody's gonna step in that, and I think I'm gonna step in a
I
piece
wouldn't
of gum.
spit it on the ground.
A lot of people do.
Yeah.
I've had a lot of personal
would
personal
never.
traumas related to that.
Okay. Is it bad to crack your knuckles, neck, or back?
Oh, I hope not. Actually, it's not. It's really not harmful at all. You've got little gas bubbles. That's kind of what you're hearing. In fact, I'm
Yeah. I know, I
kind
heard
of
it
cracking
too.
them a little bit.
But I was always told that the more you crack your knuckles, that they get bigger.
No.
And so you would have, and maybe that's another thing that my mom told, or someone told me along the line, that if you crack them, they're going to get big. And I had a fear that I was going to have these big knuckles. So I would not pop my knuckles.
Well, as humans, we like to associate things, and there are a lot of people that have enlarged knuckles, from types of arthritis or various types, including the wear and tear, the osteoarthritis, and you can get big knuckles from there. And perhaps, I'm sure, so many people crack their knuckles that somebody might associate it with that. But just being a normal knuckle cracker, it's not going to cause any issues.
What about your back?
Fine. I would caution you against doing that neck stuff, where you're really kind of cranking that.
That's my favorite thing to do.
Well, if you've got a healthy spine,
I
it's
do
not
it to
gonna.
myself,
You're not gonna.
though. I don't let other people do
With
it.
a healthy spine, you're going to be okay. But some people can have instability there, and many folks won't know they've got instability until
it happens.
Yeah,
that always scares me to have someone crack your back. For some reason, I get really nervous about that.
Yeah, I get nervous too. I ultimately, as far as the knuckle cracking, there. By the way, there was an individual that just cracked one hand, the knuckles on one hand for about 20 years, and then there was no differences between the two hands, and they solely cracked one repeatedly for the purpose of testing this question out that
That's
you guys
such
have.
restraint to only do one
Dedication.
hand.
That was immense dedication. So no, just normal routine knuckle cracking. I'm not talking about slamming it down on concrete.
Right,
trying to get it to
that's what I
pop
was
or
just thinking
something,
about,
something
yeah.
ridiculous. But
Okay.
This is a good one. I lost it. It was on here, but anyways, can stress turn your hair gray?
yeah, sure,
How?
and make it fall out.
Is that the cortisol?
Cortisol. So the cortisol can affect the stages of hair growth. Hair has phases where it grows and slows and then sits still for a while and rests and then sometimes falls out. And your cortisol levels and stress can certainly drive that. In fact, when I was in medical school, I hate to tell this story. Medical school is stressful, and every day you're worried that one bad test and everything you've worked for is gone or something. And I was in my 30s and I had a shingles outbreak 1 week in my 30s, right across my head, and then my hair was falling out up here.
Yeah.
And so I was in the mirror, looking, and I'm was I always receding there? It looks kind of white up there, like it hadn't seen the sun in a while. And so I've taken pictures. I'm not going to show them to you, but I when you go back and you look, I looked 20 years older. With a strong receding. My hairline was back to here. That was stress.
Well, if you look at college football coaches or people in high stress positions like the president, you can say, if you look at them at the beginning of their term and then after their term, they look significantly older, decades older sometimes.
Yeah, stress can definitely do that. And as far as the graying part, yes, to a little degree, the stress can affect, getting a little bit gray or a little bit sooner. But most of your hair, and as far as whether it falls out or it doesn't, and what pattern it does it, or how soon you turn gray, that's 98% genetics and luck or bad luck, depending on how you view things. Yeah.
Interesting. So we're going to wrap up here in a few minutes, but I think we have time to maybe get 2 or 3 more questions in. So what causes pins and needles when a limb falls asleep?
Oh, that's terrible. You know, in our clinic, we take care of a lot of patients. You know, some very healthy, and some have been through a lot. And you know, the pins and needles feeling that you get. Could you imagine if you felt like that every day, all day? Mm-mm. And so, and that can happen as well. But what you're describing is probably, you know, sitting on the toilet for a while and a leg goes numb, or sleeping wrong, or something of that sort, and this has to do with the nerves being irritated. And so if you sit for a period of time and compress the blood flow to an area, you're going to irritate everything distal to that, everything further away. You know, so if you were to cut the circulation off on your on your wrist, for example, you know, the fingers may start to feel tingly, perhaps numb. And when you start to get the feeling, when you remove that compression and they start to get the blood flow back, they're quite irritated, and then they may tingle or hurt. And like I said, unfortunately, that irritation from medical conditions related to diabetes or heavy alcohol use or other things that can damage the nerves permanently, that unfortunately some people suffer from this all the time.
Right.
And it's terrible.
Like after cancer treatment or different things like that?
Yes, that's correct. Some of the cancer drugs that help save your life can also sometimes affect the nerves. And unfortunately, it's the price we have to pay to save a life.
Yeah. And on that same note, when you get scared or startled, you know, and you have like that it's not a chill. It almost feels like the needles, but all the way down, like everywhere. Mm-hmm. What is that?
Well, that one is really complicated. And if there's a pass button, I would hit pass.
Okay,
pass.
all right, fine.
But it has to do with the brain and the connections to the muscles and the sympathetic nervous systems, similar to that feeling that you get of falling, like where you're kind of half asleep, not really half asleep. That's more of a disconnect between the signals the body expects to get from the muscles and what they're actually getting.
It goes back to kind of like the fight, flight, freeze thing. I know when I've gotten really, like I've had a panic attack, gotten really scared, my mouth went numb, my tongue went numb, and it's a very weird feeling. But I think it's kind of the same thing as your just signals are all messed up.
Yeah, and I think it goes back and reinforces that the mind and body connection is very, very real.
Yeah.
And you know, if you feel like you don't feel well, you're probably going to feel worse. And if you feel positive, or if you feel like you're doing well, or if you feel like you're going to feel better. But again, you can't just say calm down or feel better.
Well, and I think that's why we're seeing a trend towards mental health awareness, and because your mental health matters. Your mental health plays a role in our health. So.
Yes, it does.
Got to be positive.
Always, if you can.
But yeah, I know it's not always easy.
Therapy can help.
Mm-hmm. Let's end on a high note.
Okay.
Let's pick a funny question to end. Do you see any?
No, all of them are sad.
Oh.
But I made you laugh, so you're healthier already.
No. How about
how do I stop snoring?
Yeah, there you go.
Okay.
That's a funny one.
the
I know that's complicated too.
The easiest way to do that is to sleep on your side or prop your pillows up just a little bit. That can help with the snoring that you get. People can snore. Really, the airway is getting obstructed just a little bit. And that could be due to anatomy in the mouth or the throat. It could be due to gaining weight and having things pushing on kind of on your airway here. It could be issues in the brain. But snoring is very, very common. And other than just like elbowing.
Yeah, and I was
getting elbowed.
That doesn't work for me. I'm a snorer, and I do
Roll
not wake
over.
up.
Yeah. So what I would say is lay on your side.
I do fall asleep on my side, but then my husband says that I snore when I roll on my back.
Yeah.
Okay, there you
And then
go.
he tries to get me to roll over, but I'm
So we
dead
gotta
to the
put
world.
like a pillow, like a big body pillow behind your back, so you can't
Yeah.
like roll
or
on
a
your
wedge.
back.
Or a wedge.
Yeah.
What I will say is if you snore.
What about those things you put on your nose? That's
I have tried them. He says they kind of help, but, not completely.
Most people don't snore through the nose.
okay. Yeah, it's through the mouth.
It's deep in the back. It's deep in the back. If you snore and you're really tired when you wake up and you don't feel like you're getting good rest, talk to your doctor. There may be related to another medical
Good
condition.
plug, because sleep health is another serious thing that people don't, often think about, is if they're truly resting while they're sleeping. And
You wouldn't want to have high cortisol levels when you wake up, higher than you should have them, right? And so sleeping can help lower stress.
You could get a sleep apnea test at our sleep lab.
So sleep apnea would be the condition I was referring to a second ago. Snoring does not mean you have sleep apnea. I don't want to get people worried, okay?
Right.
But if you feel really tired, like you're going to fall asleep during the day, folks with sleep apnea often have higher blood pressure, and it affects sex drive, and it affects oftentimes can give you headaches in the morning. If you're checking some of those boxes, talk to your doctor. And we've got a great sleep lab here. Dr. Issa's wonderful, and you can get screened for that. But snoring usually is par for the course with sleep apnea, but just because you snore don't mean you have sleep apnea.
Okay, I have one more just because we live in South Georgia, and this affects everybody if you've ever been to South Georgia. Mosquitoes.
Okay.
No, mosquitoes is worse.
Yeah.
Mosquitoes. What causes the mosquito bite to itch? And then how can you get it to stop itching so you don't scratch it and cause it to...
The itching is related to histamine release in the skin. And, you probably have heard of antihistamines that you can take, with itching, that Benadryl or medicines similar to Benadryl. But, Benadryl is going to make you tired, and as opposed to taking that every time you get a mosquito bite, people say things like rubbing it. That might help a little bit. But really like cold compress or putting some cold on it, that can help reduce the blood flow to the area and the delivery of more histamine release. And so if you just got it in a few spots, like a little cold compress or something cold, that can be helpful aside from taking a medicine. We always like to use as little medicine as possible. So if you don't have to take a pill and you can get away with something like that, then go for it.
Well, you wouldn't want to have to take a pill every time you got bit by a mosquito.
No, but you usually don't get bit once.
Yeah, it's multiple.
Right? It's like the whole leg or
they just
something.
come.
Yeah.
They
at you.
love me.
Yeah.
They bite me all over.
Yeah, that's a whole nother question about why
because
some
you have a
people
lot
get
of sugar
bit
in your
more
blood.
Well,
than
let's go ahead and
others.
answer it. Why?
Do you know that?
I know that some people are more fond of
Okay.
getting bit than others.
Okay.
I don't know the mechanism.
I'm not
behind
fond of it. I don't like it.
The mosquitoes are fond of you.
One
Yes,
bit me on my forehead once. How rude is that?
Oh, that's terrible. And you could see the foam coming out. That's my
Yeah.
daughter. I have a teenage daughter. That would be her worst nightmare.
Yeah. All right. Well,
This was
that was
fun.
good.
I feel like we could do this all day long,
Yeah, that
but
was fun.
we can't because that'd be the world's longest podcast.
Yeah. But we appreciate you
Yeah, thank
taking
you.
the time
Thank you for having me.
out of your very busy schedule to treat very serious issues
Well,
and
not-
take care of all the people of our community. But like you said, we got to have fun, not take everything very serious.
Hopefully, this episode makes some people laugh.
Hopefully you laughed a little bit.
And for any of our patients, if you've got questions like this, ask us in the clinic. We love to field stuff like this. We absolutely do. I think this was on a previous podcast where people Google things and they bring up these questions and we enjoy it.
The people want to know.
That's right.
They want to know.
They're asking.
So if you have more questions like the ones we asked today or more serious questions that maybe we can try to help you answer or at least, direct you to one of our physicians, then you can submit them at sgmc.org/podcast.
Yeah. So thank you all for tuning in, and thank you, Dr. Hayes, for being with us today.